So my job title is Strategic Lead for Children's Centres in Cumbria. So I provide our centres with a lot of day-to-day support, and I'm really involved at the moment in recommissioning our services, so we have a combined offer between our early help and children's centre offer and our health visiting service through the Healthy Child programme. So we have been offering Bookstart for many years in Cumbria. I feel it's been done in quite a separate way between the three different workforces. So health visitors have been gifting the Bookstart baby, children's centres have been focusing on Bookstart Corner, and then our early years providers have shared Bookstart Treasure. And I think by integrating our services better, it gives us a real opportunity to look at the whole pathway and how we're all supporting the whole Bookstart offer. So the benefits of co-location between health visitors and our early help providers are that it provides much more of a one-stop shop for the family, so that when they turn up at a children's centre, there's a variety of people there that have an interest in supporting them and meeting their needs. It's also an opportunity for both workforces to join together to promote the same messages, so messages around health, around physical development, around communication and language. They can really be shared, and that joint message comes across more easily. By working closely together, our health visitors and early help providers are in a better position to be able to identify the families that would most benefit from Bookstart Corner. A real focus for us over the last couple of years has been developing home learning, and we really want to support families, particularly our more disadvantaged families, to have the confidence to know that everything they do within the home, every conversation they have, is the best they can do for their child. And through using Bookstart within the homes, we really feel that's a gift and an opportunity to really show families that actually, you are the biggest resource that your child needs, and for them to have enjoyment and for them to see that it's a really positive experience is really the best that we can give them. We want to really prioritise encouraging the daily reading and sharing of books, using language, letting families know that it's not something that needs to take a long time, that it can happen, naturally throughout the day. And it's really important for the families that don't have access to books to have that first opportunity. In order to complete this kind of really complex piece of commissioning, we've had to have buy-in from all sorts of different people at all sorts of different levels. So at the highest level, we've had a programme board with directors, assistant directors from the local authority, from health and from our third sector organisations, and they're obviously the key decision makers. More on the ground, we've had a very active working group who've really tried to sort out the practicalities in terms of where people are going to be based, what ICT systems they're going to have. We've sort of really been doing the groundwork, developing the specifications, putting them out to consultation, adapting them according to feedback. It's been really important to have a clear communication strategy between all the organisations, because as soon as people hear about merging services, they're worried about cuts. And of course, it's been really important to have buy-in from our elected members. So our workforce development going forward will focus around developing a pathway within Cumbria for Bookstart. So rather than using it very separately, we want to really think about how it can be maximised so that families can be supported both by the universal offer from the baby Bookstart onwards, and how we can really use it to support our more disadvantaged families and those who we've identified as being in need of additional support. So we recognise that change takes a lot of time, and this is only the first step towards being integrated by co-locating and developing combined specifications. But looking further into the future, we really would like to have shared aims and objectives, and for families to receive the services that they need from a really integrated hub.